I've worked in the mental health world for over 10 years now, as a campaigner, as a charity trustee, a policy manager, and now as a consultant and trainer to businesses. A lot has changed in the last 10 years, a lot has improved. We certainly talk a lot more about mental health than we did 10 years ago, that's for sure. But I often find myself reflecting on how much has actually changed. How much more do people know about mental health now? How much have our mental health services improved? Has the stigma around mental illness actually reduced? And whilst I like to be a positive person, we really have to be realistic. And my take on it is this: we definitely have more awareness, but do we have more genuine understanding and education? Have we taken more meaningful action? Not yet. Awareness is knowing that something is there. I can be aware of a social issue, I can be aware of another culture, but being merely aware of its existence doesn't mean I really know anything about it. It doesn't mean I have any education or understanding of that thing, and it certainly doesn't translate into meaningful action or change on my part. I see this a lot around mental health as a topic at the moment. On awareness days like World Mental Health Day, people will take to social media to post an awareness graphic or an uplifting message. And whilst it's so great to see platforms like Instagram awash with mental health awareness, it only really lasts for that day. Do those people go on to learn more about mental health? Do they take a training course? Do they change their behaviour? Not in most cases. And big businesses or brands, they often use awareness days to show their support too, to show that they're mental health aware. But it can feel a bit like a shallow PR move if it isn't coupled with real action. Are they also upskilling all their staff? Are they trying to change toxic work patterns? Are they thinking honestly about their culture at work? Not in most cases. And then there's the newspapers and the print media. They jump on the chance to publish an article about mental health awareness because it's a hot topic. But a few pages later, they're back to tearing apart celebrities and contributing to a toxic culture that doesn't help anybody's mental health. Arguably, all of this is awareness, but none of it is education, understanding, or meaningful action. Over the last few years, there's been a focus by the government, the NHS, and campaigners in the UK on improving mental health services. And rightly so. They are still dramatically underfunded and overwhelmed, and there is such a lot of work to do. But that is all focused on helping people who are falling. What, as a society, are we doing to prevent the fall? We have to go upstream in all of this as well. We have to look at prevention as well as treatment, being proactive as well as reactive, and we have to try and prevent that fall, at least for some people. And this means going further than awareness, further than an Instagram post, an article, or a policy. The next step is education, thorough mental health education. Knowledge is so powerful, and it helps break down the fear and misunderstanding around mental illness. And it makes things so much worse because stigma can be fatal. I have seen no real change in the mental health IQ of the nation in over a decade, and it is time to upskill. In my opinion, mental health education should be taught as a module every year in every school. We know that around 50% of adult mental health conditions start before age 14, so our young people need to be equipped and armed with strategies and information well before that. We need content written by experts that is age appropriate and a mandatory part of the national curriculum. In workplaces, some companies are training designated first aiders for mental health as they do for physical health. I think this is a great idea, but I think we should go so much further. In my mind, all managers should have mandatory mental health training. Regardless of the industry, it is so important that if you are managing a team of people, that you understand mental health, stress management, and burnout. And universities. There is such an amazing opportunity to teach young adults about their mental health. Every university should build in a couple of days of student coaching and mental health education right at the beginning of the journey into higher education, and repeat it every year. Let's equip students with a better chance of navigating the transitions and challenges of university and give them a life skill that they can take beyond. It's important that students know where support is and how they can support themselves. This isn't about over-medicalising or making every place of work or study into a crisis service. It's about giving each individual the tools and understanding as a preventative measure. We can't expect people to know what we don't teach them. We can't keep waiting for people to fall and then realise that our mental health services can't catch them. And we can't keep losing amazing, wonderful people to a preventable death such as suicide. Now, in this talk, I can't just go on about the importance of mental health education and not offer any as a trainer myself. So I've boiled it down and I'm going to share the 3 simple things I wish everybody knew about mental health. Number 1, mental health does not mean mental illness. The 2 words are not interchangeable and it matters. Why? Because we constantly mix them up and we only ever talk about mental health when we actually mean illness. In actual fact, mental health exists in us all and it exists on a scale from wellness through to illness. And we should be using the correct words. Mental health is the whole scale of mental health and mental illness is one end of that scale. Think about it. If I asked you about your physical health, you wouldn't deny you have it. And you would probably also think about things like your fitness levels, your nutrition, your wellness, not just about whether you have a physical illness. So why isn't it the same for mental health? How many times have I heard, oh yeah, I know somebody with mental health? That statement doesn't make sense. What they mean is that they know somebody who is experiencing mental ill health. But getting the words wrong creates a kind of us and them mentality, when in actual fact we are all on the mental health scale. And it can change and fluctuate based on so many factors. Things like our stress levels, our relationships, finances, our physical health, past trauma, and so many more. And just like with our physical health, there are steps we can take and habits we can build into our daily lives to look after our mental health and keep ourselves up that scale towards mental wellness. It isn't a protection against ever experiencing mental ill health, of course not. Just like being physically healthy isn't a protection against ever getting a physical illness. But it does give us a better chance at being well and feeling good and quicker recovery. Number 2, early intervention for mental ill health is crucial. If we start to struggle with low mood, our stress levels or anxious thoughts, and it begins to limit or affect our lives, we need to find some support now. That might be social support, like speaking to a friend or family member. It might be community support, like social networks, groups or hobbies, or professional support, like seeing your GP or contacting a mental health helpline or seeking that support online. The earlier we seek help, the easier we are to be helped. We so often tragically see people slip the whole way down the mental health scale before they seek help. They end up in crisis and at breaking point. And the truly sad part is that before that point, they didn't think it was bad enough to seek help. And we see this particularly affect high-risk groups who suffer from a lot of stigma, such as young men, and this translates into higher suicide rates. The earlier we can get people to ask for help without shame and before they are in crisis, the better. Recovery journeys from mental ill health look different for everybody, and finding the right medical, community or self-support can take time, but starting early helps. Stigma can kill, but early intervention can save lives. Number 3, self-care is not selfish and it's not just about bubble baths and pampering. The word self-care has blown up into a huge lucrative industry selling everything from yoga mats to blenders to face masks, all in the name of self-care. It's left us thinking that self-care is just about treating ourselves. And whilst that's a lovely thing to do, it can leave some people feeling that self-care is a privilege, that it's not for them, that it's expensive, or that it's selfish or self-indulgent. In actual fact, self-care is about survival, not luxury. It's about listening to yourself, looking after you, and making a choice for your situation right now and where you are on that mental health scale. Sometimes self-care is not about treating ourselves, it's about parenting ourselves. Things like making sure we get enough sleep, making sure we eat a balanced meal, getting ourselves up out of bed and pushing ourselves to take the shower. Self-care can also be saying no to things, drawing boundaries, deciding that something or somebody is having a negative effect and trying to reduce that. Self-care can be stress management strategies or lifestyle choices. And sometimes self-care is as simple as us reminding ourselves to drop our shoulders and breathe deeply into our tummies to calm our anxious brains. Don't let the world of consumerism convince you that self-care is an expensive, indulgent thing. It is the simple act of caring for yourself, and everybody deserves that. I'm going to leave you with one final thought. The next time you hear somebody talking about mental health awareness, challenge them to take that awareness and turn it into education, understanding, and maybe even into meaningful action. Thanks for listening.